When I initially went into medicine, I was very interested in global health. During my residency, I was able to spend some time in Uganda. And I spent a couple of months there working as a resident in a local hospital. And what I saw of people not having access to safe abortion, people having experienced unsafe abortions, and people having pregnancies because they weren't able to access the appropriate contraception. And that really moved me and motivated me to want to learn more about abortion and contraception and how I could have a career in that. I was a resident at Albert Einstein in New York, and I actually trained where Dr. Rashbaum had been a provider. And it was really moving and exciting to be able to provide care for people who really needed it and to see how profoundly abortion care could change someone's life. I was first motivated to pursue advocacy as a physician in 2011, which was around the same time that I was able to do the Physicians for Reproductive Health Leadership Training Academy. Also, the time that our state legislature had started to pass abortion restrictions that were going to really change how we were able to provide care for patients.
Talking about the Women's Right to Know Act, Planned Parenthood has already sued the state over the budget. Now other groups are joining this fight.
I was put in touch with a lot of different activists in the state who were doing work around these issues. I was able to go to the Capitol and testify. Eventually, I also was part of the lawsuit that sued against this bill as well.
After months of waiting, a federal judge has declared North Carolina's ultrasound abortion law illegal.
This is something that I can do with the privilege that I have, with the expertise that I have around these issues, and with the patients that I take care of.
Dr. Amy Bryant, the OBGYN who is the plaintiff in this suit, writing in part, these burdensome restrictions on medication abortion force physicians to deal with unnecessary restrictions on patient care and on the healthcare system.
We've been using this for over 20 years now, and it's clear that this has an exceptionally safe record.
Medicine is a social justice issue, and medicine requires physicians who are willing to stand up for the rights of patients. I always knew I would do advocacy as part of medicine. I just didn't know exactly what it was going to look like.
I mean, you're fine, because it's just a straightforward.
It is extremely gratifying to work with students, to work with residents, to work with fellows, trainees of all different levels who are interested in this care. This move towards much more patient-centered care and compassionate abortion care, I think it is a very beautiful thing. When learners see that modeled and when they are able to provide that care, it is very empowering. To be recognized by my peers and people that I admire so tremendously, it's just very humbling and just an extreme honor.
So I've known Dr. Bryant since 2009, actually, when I interviewed to become the second family planning fellow here. She was the first one. She, sacrifices so much to make sure that others, are being taken care of. And she spends her weekends, canvassing and stuff just to make sure that reproductive health, is protected in the state and the country, whether it be, at the court level or the North Carolina legislature, to make sure that they are all aware of the impacts that they make when they make bad decisions, and that, there are better decisions that should be made to protect access to everyone.
There are many of us who do this work and who are, working together in community, in partnership to try to advance care here in North Carolina.